Dr. Thirion, Sylvie, thank you very much indeed for giving us a couple of minutes. You presented some really very fascinating data on pituitary adenoma and the molecular biology, and particularly focused on a receptor which was new for me, a protein called ghrelin.
Yes, exactly.
Tell us about that.
So, you know that somatotroph adenomas are characterized with GH hypersequestration and a sustained sometimes proliferation, and usually the patients bearing this kind of tumors are either surgically operated or treated with somatostatinergic agonists. Unfortunately, some patients are insensitive to this medication. So our goal is to find an alternative approach to give a new pharmacological treatment to their insensitive patients. And the ghrelin is an hormone which regulates physiologically GH secretions. And interesting, its receptor, it's a GPCR receptor named GHS-R, has not only the ability to answer to ghrelin, but also owns a high ligand independent constitutive activity. And this constitutive activity has been shown to be implicated when she is suppressed in nanism, in a growth delay in tumorous families. So we hypothesized that in somatotroph adenomas, it could be relevant, this constitutive activity, in the tumorigenesis of the somatotroph adenomas. So we use a compound named SPA for substance P analog, which is able to act as an inverse agonist on this GHS-R. And when we put this compound on our primary culture of somatotroph adenomas, we observed a decrease in the GH secretion. And in all tested tumors, we have a decrease in the GH secretion. So our next part of our works has been to see the implication of the ERK1/2 MAP kinase activation in this constitutive activation, and with a very beautiful
mutation.
Yes, with a beautiful tool, we have been able
the threat.
Yes,
so,
the threat ECA probe. Sure. We are able to follow in dynamics the ERK1/2 MAP kinase activations under SPA applications.
Okay.
And we record that under SPA applications, we have decrease in the ERK1/2 activations. So it seems that the MAP kinase activations could be important in the constitutive activations of the ghrelin receptor. So it's a very new approach, and we hope that in the future it could be nice tools to be able to have a new treatment
Sure.
for the somatotroph adenomas.
Is ghrelin involved in any other kinds of tissues? All tissues?
Yes, ghrelin is very pleiotroph hormone, which regulate meal begin, which regulate the sleep, the anxiety, is a very pleiotroph hormone.
Okay, and that MAP kinase pathway, which you have found to be so important to the activity of this substance P, is also, of course, involved in a lot of other tissues and a lot of cancerous tissues.
Yes, well, right, and in particular in proliferation. And our next step will be to see the effect of this MAP kinase activations with this constitutive activity in the proliferation of our adenomas, somatotroph adenomas. And we can guess that in other cancers it could be also relevant.
Let's hope so, Sylvie. Thank you very much indeed.
You're welcome.
Appreciate it.
It was a pleasure.